Help is just 3 numbers away. The 988 Suicide and Crisis Lifeline launched 3 years ago in July 2022. Before that, there was a 10-digit number. It still exists, but it was shortened to make it easier to remember. 988 aims to help people experiencing thoughts of suicide or battling emotional distress or substance use disorder. The vice president of programs for one of our area's crisis contact centers explains it can be a proactive resource.
I want to kind of address a myth that exists about 988. So I think a lot of times people think, oh, I have to be having thoughts of suicide to call 988. That's what the line's for. But it's really not. It's the Suicide and Crisis Lifeline.
Every state has a network of crisis contact centers to take and route the call. In Indiana, there are 5, one in Fort Wayne, Gary, Indianapolis, Lafayette, and Muncie. They're overseen by the state's Family and Social Services Administration Division.
So as the calls come in, it gets routed to the first available, counselor so it could be at any one of the 5 call centers.
In Michigan, there are 3 contact centers: the Michigan Crisis and Access Line, or MyCal, Griffin Place, and Macomb County Community Mental Health. Coverage is different than Indiana because calls are dispatched by location. The Michigan Department of Health and Human Services says MyCal covers 85% of the state, whereas Griffin Place covers counties such as Kalamazoo, Calhoun, Cass, St. Joseph, and Van Buren.
We have a 988 work group in which there's representation from all 3 centers to talk about standardizing some protocols, taking a look at the data and the metrics, and ensuring consistency in 988 across the state.
Sailors and Everett say all of their crisis specialists are extensively trained. The vice president of programs at Griffin Place explains what goes into it.
It's a minimum of 80 hours when they onboard. And so we start with assist training, which is applied suicide intervention skills training. Once they complete that training, it's a mix of classroom, online, and simulation-based training.
Kip says specialists are trained to assist people of all different backgrounds, from people with developmental disabilities to the LGBTQIA community to older adults. There's a push to connect specifically for veterans or Spanish-speaking individuals. Kip emphasizes there's training for specialists on their self-care.
Because it's really important for us that our people, our crisis specialists doing the work, are taken care of so they can continue to provide high-quality support as well.
According to the CDC, nearly 50,000 Americans die by suicide each year. That's 1 death every 11 minutes. It's also one of the leading causes of death in teenagers.
We're all in this together, and that it doesn't matter, how others might perceive the crisis. It's about how you perceive it, and we want to just meet you where you're at.
You can also make the call on someone else's behalf. Kip says if you're worried about a loved one, you can give Griffin Place their number and they'll contact the person. Or, she adds, a crisis specialist can coach you on how to approach the situation.
But if that's not possible, we can step in. We can also do 3-way calling. So we could potentially call the individual while you're on the phone with us as well.
No matter who you're calling for, a real person will be on the other end of the line.
Thank you for calling 988 Lifeline. My name is Terry. How can I support you today?
If you're not comfortable being on the phone, you can text 988 in Indiana. Everett says Michigan is working on its system to receive texts, so they're answered by in-state crisis specialists. WSBT-22 asked both officials about the possibility of expanding their response network. They believe Hoosiers and Michiganders have comprehensive support.
If volume tends to go up and we need to add, we will find ways, right, to be able to expand that network. But I think the network we have right now is meeting the needs in a really good way.
Thanks for watching. Here's another story you may like, and subscribe to the WSBT 22 YouTube channel.